Hey everyone, my name's Daniel, and yesterday, the 11th of September 2025, I went to Fulwood Hall Hospital, Ramsey Health, for an adult circumcision, and that's due to phimosis and BXO. So I've written a few notes down just to document this, so hopefully it can help others, because whilst I was searching, I couldn't find many people's testimonies or anything like that. So when I arrived at the hospital, I went down to a patient's waiting room for 7:30. I waited there just over an hour, and then I was taken to the inpatient ward, and I was seen first by a surgeon and then the anaesthetist, and then later on I was admitted by the nurse. Kind of nervous at that point, being in a hospital setting. All the tests, the pre-operative tests and everything came back fine. I remember going down around 11:45 or something like that, and I was back in the room that I was in. It's like a little pod area, for around 1:30 in the afternoon. At which point I was asked if I wanted to sit in the chair, and I couldn't. I was still coming round from the general anaesthesia. I was given three digestive biscuits and 2 slices of jam on toast, as my blood sugars were quite low and my blood pressure was quite low as well. I then shortly after moved to the chair, and the nurses kept coming over asking if I'm ready to pass urine, so it probably was one of the checklist things that they need to go to the bathroom before they're discharged. Glad to say I managed to, and even though it felt more weird because you have this bandage dressing around you as well, which can make it really much more difficult. I was discharged with a 3-week fit note, given senna, codeine and antibiotics, and told to take over-the-counter paracetamol if and when I need it. I got home around 3:30. I had something to eat and drink, and yeah, my dressing that should have been on for 24 hours, which is nearly now, it fell off after about 6 hours, so I was a little bit worried about that. And yeah, I think I went to sleep around 8 o'clock last night, so that's day 1, or the day of surgery, and I'm going to leave it there and film day 2. And I am still on day 2, so